Sometimes it's difficult to plan or look forward to things. It's tricky. It has and it does weigh on my self-esteem.
Taking care of your health is your priority, and how you feel is your own responsibility. Usipoziba ufa, utachanga ukuta. So understanding the why behind the medical advice, connecting the medical dots, connecting the medical dots, the medical dots.
Okay, so hi guys, it's your girl Lydia PC here, back again with another educational, motivational, and inspiring video. If you're new to this channel, please feel welcome. I am glad to have you, and I hope you'll enjoy this content as much as we do. And to you, my subscribers, thank you so much, guys. Thank you for continue sharing my videos and spreading the word about my channel. I hope you've been finding the content enriching. So for those who are not familiar with me, I am a medical student currently in my 4th year of medical school. And I currently took like a break off from school to focus on doing research in dermatology. And one of the things that I'll be studying for the next 1 year is a disease called Hidradenitis Suppurativa. You know, commonly or colloquially or very loosely, some people call it like boils. So medically defined, it's a chronic inflammatory disease that affects the hair follicles, okay? But if we talk about it casually, you know, it's like someone who has recurrent boils in their armpits, groin region, the anal region, or perianal region around, you know, your butt cheeks, for lack of a better phrase to use. But also some people can experience it in the face, in the chest, and any part of the body. But usually it's like having recurrent boils in your armpits, your groin, and around your buttocks. So today I'm here with Brianna. This is not the first time she's in my channel, or our channel rather. So I'll just let Brianna, could you please introduce yourself?
Hi, I'm Brianna. Thanks so much for having me. I'm excited to talk a little bit about my experience and my current journey with hidradenitis, or HS, as many people refer to it. Thanks for having me.
You're welcome. And thank you so much for your braveness and willingness to come to this channel once again. This time around, we are not just learning about science from like books, but you're also here as someone who has suffered from hidradenitis suppurativa. And again, thank you so much for being brave enough to come to this channel and share your story. I appreciate it. And I hope that this video will continue to create awareness about this disease, to minimize or decrease the stigma surrounding this disease, and to shed a lot of light from a science perspective and from a patient's perspective. And before we start, a disclaimer out there, like I said earlier on, I am a medical student. I am not a medical doctor. I am not certified to offer medical advice. I am just learning about diseases of the skin and learning from patients like Brianna as well. And I'm using this channel to learn and also take you with me. So welcome together as we learn together. So Brianna, when were you first diagnosed with HS?
That's a funny question. It's an interesting question, and I'm going to tell you why. At the time that I started experiencing the symptoms, the boils or the abscesses, like the pain, discomfort, all of that, there wasn't a name for it. At least none of the doctors I saw at like urgent care, etc., knew what to call it. But I probably started experiencing those symptoms like in college. So 2007 through 2011, when I was in undergrad, and I would have them and didn't really know what they were called, didn't know why I was getting them. I remember one instance where I had a flare up. That's what I call them when I have the abscess. And I went to the doctor and they were treating me for like a staph infection, like MRSA. They didn't understand what was happening. So I was like using this cream that they made me put like behind my ears and underneath my fingernails while they like spit off what they like drained off of me. to get it cultured and tested and all of that to make sure it wasn't something else. But it didn't have a name at that time. And I think slowly it got a name. And I was like, that's what I have. I know that's it. That's what I have. Um,
Mhm.
Finally got into, I've always had a dermatologist because
Mhm.
eczema, I suffer from eczema as well, which is interesting because
Mhm.
there's maybe some sort of correlation there. Um,
Yeah.
my college years. And then I will say the more I got into adulthood, like my 20s, even now into my 30s, it is definitely increased. My flare-ups are a lot more frequent the older
Mhm.
I've gotten.
Okay. So yeah, you've brought up very interesting point. So I know I asked you when you first started, when you were diagnosed with HS, which it's the short form for hidradenitis suppurativa. So like, when did you start experiencing the symptoms and what did you experience before we even get to diagnosis?
Yeah, I would have um, very tender, like swollen, like nodules to begin with,
Mhm.
before I even know like it was called a boil or you called it a boil or an abscess. I would have very
Mhm.
tender, um, like growths, if you will, um, on my body. And I didn't know what they were. They would progress, um, or sometimes they would like go away on their own. So it was like, what is this? I don't really know. Da, da, da. I was in college. I was trying to have fun. I was like, what is this? I don't need this.
Yeah. Mhm.
Then one time it got really, really bad to the point where I couldn't walk. I couldn't attend class. So my parents took me to urgent care. Urgent care again did not know what to do. Um,
Mhm.
and I ended up just getting antibiotics, which
Mhm.
sometimes will help, but if it's really far gone, like it's super inflamed, which my situation at that time it was, um,
Mhm.
the antibiotics didn't work. So I continued to
Mhm.
have that pain, that discomfort. It continued to get larger and larger.
Mhm.
And finally, I went back. My parents took me back again because now I was at the point where, like, standing up straight, I couldn't. So I was like walking very hunched over. Um,
Mhm.
and they finally lanced it, where they actually go in and drain it. They packed it. Um,
Mhm.
they sent it off to try to
Mhm.
understand what it was. And in the meantime,
Mhm.
started treating me for a staph infection.
I
Um,
see.
so that's typically what happens. It's a very it can start off very, very small. Um,
Mhm.
then it will progress, it'll get large, it'll be hard. There'll be a little
Mhm.
soft area in the middle, which I call like the head of it. And
Uh-huh.
it'll either sometimes it reduces on its own. Like if you
Mhm.
heating pad is my best friend. I
Mhm.
have it somewhere near me. A heating pad is my best friend. So heat will
Mhm.
help reduce that inflammation. Um,
Mhm.
any type of, NSAID, ibuprofen will
Mhm.
and then yeah, like you kind of have that discomfort and
Yeah.
then it you just don't realize when you have until you have the flares, if you will, you don't understand, you don't realize how much like my mobility is off. I become very fatigued, very
Mhm.
tired, because I feel
Mhm.
like my energy is being sucked to this one place.
Right.
Um,
Yeah.
I'm probably rambling at this point, but yeah, that's pretty much how they go. They vary
Yeah.
in degree of severity. Fortunately,
Mhm.
I haven't had to go and have one like surgically lanced in a long
Mhm.
time. Um,
Mhm.
most of the time I'm able to kind of treat them at home.
Okay. Okay. Yeah. No, you're not rambling because you want to hear that patient experience. Because again, this is a disease that is, first of all, underdiagnosed. And then when it's diagnosed, well, it takes even doctors like who are not like experienced dermatologists to even recognize the disease and give it a name and tell you like this is your diagnosis. So I think it's important to hear your story. So you start having these symptoms, you go to urgent care, then you have to go again, and now they suspect a staph infection, they start treating you with it. So when did they like, and who did diagnose you with and came and told you like you have something called HS? And how was that experience? How did they break the news? And then what did they tell you afterwards?
Yeah, after that first flare,
Mm-hmm.
I remember a period of like, I don't know if you can call it like remission, where I didn't notice them that much
Mm-hmm.
anymore. And then
Mm-hmm.
it's funny, after I graduated, I remember moving to Georgia and then moving to Charlotte. And that's when I remember them flaring up all over again. I don't know why. I can't pinpoint a particular event that triggered it. But I
Mm-hmm.
started going to a dermatologist. And honestly, I was going to the dermatologist for my eczema.
Mm-hmm.
I didn't know this thing had a name, and I didn't know
Mm-hmm.
it was related to my skin, because you don't
Mm-hmm.
relate it to your skin because it's underneath, like it feels like it's
Yeah.
from your skin, but your body gets
Mm-hmm.
tired. You're like, this has to do with my skin. I
Mm-hmm.
think I mentioned it. I showed it to my doctor, and he was like, "That's hidradenitis," and
Mm-hmm.
like, you've never
Mm-hmm.
heard of this before? Acne inversa, that's another name that they call it as well.
Yeah. Mm-hmm.
Um, and then from there, he was on it, wanting to try to help, but there's not much treatment for
Mm-hmm.
it. So I mean, I think through over the course of that time up until now, um, he well, I have a new dermatologist now, so I'm in a different place, but at the beginning, like I said, there wasn't a lot. He was really the first person to tell me, like, when you're having a flare up, wash with like antibacterial soap to try to like just kill off any germs that are on the skin. Because again, I didn't know it had anything to do with my skin. But
Mm-hmm.
for some reason, I showed him my underarm. I showed it.
Mm-hmm.
Or maybe I was showing him an eczema flare and he saw it. I can't really
Sorry.
remember, but he caught it. Um,
Mm-hmm.
and then washing, keeping it dry, things like that. So it was really many years later. So this is like 2015 at this point, where
Mm-hmm.
I finally had a name for it. And
Mm-hmm.
I thank God that it happened at that time, because it was at that point forward where I started having a lot more flare-ups.
Mm-hmm.
Yeah.
And how often do you have the flare ups?
I could probably have a couple a month. I could.
Okay.
There are times where it will go dormant and I don't have them. Um, but it's like I may not have a new one, but I'll have one that is still like healing, that's actively draining and
Mm-hmm.
um like still open, if you will.
Mm-hmm.
I have noticed the older I've gotten, I
Mm-hmm.
will have um like repeat flares, and
Mm-hmm.
I'll have wounds that like don't heal as fast as
Mm-hmm.
you should. Um,
Mm-hmm.
and I don't want to like jump too far ahead, but
Mm-hmm.
back in 20, was it 2021? 2021, 2022, I did have
Mm-hmm.
my dermatologist that I have now, um,
Mm-hmm.
is this is his specialty. Hidradenitis is his thing. I've participated. I don't want to get too ahead of myself though.
No, it's okay. Just talk.
Yeah, no, I don't want to get too ahead of myself, but I
Uh-huh.
between then and now,
Yeah.
I've had to get them lanced. Anyone that has HS knows what I mean when they say lance. They kind of
Mm-hmm.
numb you, stick you, open
Mm-hmm.
it, get everything out so you can have
Mm-hmm.
like instant relief.
Mm-hmm.
And that happened plenty of times. I've gone on kind of like experimental medicines where I did like a mix of rifampin antibiotic and clindamycin like together. Um,
Mm-hmm.
about that whole time, like my doctor was like constantly taking my blood, checking my blood work to make sure nothing funky was happening, to try
Mm-hmm.
to keep just put my flares at bay. That
Yeah.
honestly, you just don't shouldn't be on antibiotics long term like that.
Yeah. Mm-hmm.
Then I also started taking Humira, which is a
Mm-hmm.
biologic. I was giving myself an injection
Mm-hmm.
a week, every Tuesday. I was getting
Mm-hmm.
those injections, and that it definitely helped. But I got nervous and scared of continuing to give myself a shot. I didn't know what the long-term effects of it would be, so I decided to stop the Humira.
Mm-hmm.
Um,
Mm-hmm.
Typically outside of that, when I would have a flare, I would, warm compress, take some NSAID, and just kind of write it out. Um,
Mm-hmm.
then of course now I have my dermatologist, Dr. Syed. He's amazing. He's amazing, amazing, amazing. He
Mm-hmm.
is a specialist. He's a dermatologist, but his specialty is hidradenitis. And so um since being with him, I still do the same things that I do to treat him when I have the flare up, but
Mm-hmm.
he um actually performed what they call a de-roofing um,
Mm-hmm.
on my right arm back
Mm-hmm.
2021, 2022. And basically,
Mm-hmm.
I will spare you the details, but basically, they go in and kind of like remove the top layer of the skin to help and the sweat glands, from what I understand. If you're a person who has repeat flares in the same areas, you're a really
Mm-hmm.
good candidate for that. So I went there. My partner was with me the whole time. It was like 5 hours. Um,
Oh.
got
Mm-hmm.
that done. It's a long healing process, but
Mm-hmm.
fortunately, it significantly reduced the amount of flares that I have because I'm a person who gets them in the same place over and over again.
Mm-hmm.
And this is really kind of maybe the first time where they are reduced in one area of it. But outside of that, there's not like a whole lot of other things um,
Mm-hmm.
to help keep it at bay. And there's no cure for it. If you,
Yeah.
I think obviously the way we're talking, that goes without saying that there's no cure.
No, it's good. Yeah, it's good to create awareness there. So there's no cure for HS, but I think so far we've made a huge progress, let's say from the time you're diagnosed. And that's why like there's a lot of work going behind the scenes, trying to better understand this disease and hopefully find like better treatments for it or even cure if possible.
Yeah.
But I think it will be nice if we talk about the science side of HS. And I'm just curious, like what's your understanding of what happens for you to have those boils or abscesses?
Uh,
Sorry to put you on the spot,
no,
but
no, no. Well,
uh-huh.
I know for me, I
Mm-hmm.
guess from a science perspective, I know
Mm-hmm.
what triggers it for me.
Mm-hmm.
Know
Mm-hmm.
what stress, certain foods, specifically like dairy, um, if I have alcohol, those I know what triggers it for me. Um,
Mm-hmm.
so that piece I'm aware of. Um,
Mm-hmm.
and just the understanding of how my body like reacts to it. But I would love some insight on
Mm-hmm.
the science as terms of like what you've learned.
Yeah, yeah. Well, actually, in terms of that, again, that's another research that's going on, in terms of like the triggers for HS. Because you still, I don't think I can fully explain, like, oh, this is why when you eat dairy, it flares your HS, or when you have your menstrual cycle, it flares your HS. I still don't know. Again, we're learning this together, right? So,
Yeah.
but my understanding so far on, like in medical terms, we'll call it pathogenesis, like what is happening even at the molecular level or microscopic level that leads to HS, right? So, we have hair follicles, and mostly, where we have hair in the scalp, in the armpits, in the groin, the inner thigh, between the buttocks. So that's why a lot of people have HS around those areas because that's where we have a higher concentration of hair and also like sweat glands called apocrine glands. So the sweat glands in the rest of the body is called eccrine glands, and then we call them intratriginous areas. Sorry for a lot of medical terms, but it's where skin touches skin. So the inner thighs, the armpits, or the underarms. Yeah, so intratriginous areas, and also where we have apocrine sweat glands. So what happens is with a hair follicle, and I'll put in an image here so we can have a visual representation of like what I'm talking about. But with the hair follicle, let's imagine like a tube where the hair grows from, right? Like somewhere here. So where we have the hair follicle and it's connected to like sebaceous glands, like the glands that produce oil that, moisturizes the hair and all that. So what happens? So hidradenitis at the microscopic level is a dysfunction of the hair follicle. Um, so what happens is So within the hair follicle gets clogged. So usually, of course, we have like, again, the oil from the sebaceous gland and then the sweat from the sweat glands. But the oil and keratinocytes, the cells that surround the hair follicle and the upper layer of the skin. And also we call them like commensal bacteria. This is bacteria that just normally resides in the skin.
Mhm.
So what happens? We still don't understand exactly like what leads to that, but it's like the hair follicle gets clogged with the bacteria, not, let's say, with the keratinocytes and the oil. So it clogs the gland, and then so once it blocks it, so the bacteria in there start multiplying, and it's just bacteria that normally resides in the skin. So it multiplies. So it's like so the blockage, it's like leads to rupture of the hair follicle. It's like too much. They occupy so much space and they're like, we want more room. So the hair follicle ruptures. And when it ruptures, your white blood cells, which are like the defense mechanisms of your body, they're like, whoa, what's happening in those hair follicles? So they come and they start fighting that as if it's an infection, because it's a foreign object in their eyes, so to speak, right? So the white blood cells, they come and they start fighting. So the process of the white blood cells fighting that foreign material is called inflammation.
Mhm.
And so inflammation is what medically, like when you come to the clinic, when you say you're inflamed, it's like it's tender to the touch, so it's painful. It can be warm to the touch, and sometimes there will be some redness. Okay, so that's what happens. So again, medical definition of HS is like chronic inflammatory disease of the hair follicle. So chronic meaning it's not like a cold that will come and go.
Mhm.
It's a disease that is there to stay.
Yep.
And inflammatory, again, because of the inflammation that leads to the symptoms that you have. That's when you have a lot of pain because it's tender, because of the inflammation. Yeah. So like you're talking about the way they manage it, they can give, painkillers to help reduce the pain. Anti-inflammatory, like NSAIDs are painkillers. At the same time, they reduce anti-inflammatory. And for those who are not aware, NSAIDs stand for non-steroidal anti-inflammatory. So they're drugs that reduce inflammation that are not steroids, because steroids usually reduce inflammation. So like ibuprofen is an NSAID. And of course, Brie, you talked about Humira, which is a biologic, and those were like recent treatments, right? So biologics really, in simple terms, they just reduce like the immune response to what's happening in the hair follicle. So they reduce the inflammatory process, and so they reduce the inflammation. So does that make sense?
Yes, thank you.
Yeah.
That's super insightful. Yes, the words that you're using, absolutely, I've heard them over and over again.
Uh-huh.
But this, putting it in layman's terms, is very helpful. Thank you. Thank you.
Okay, thank you. So that's what I call connecting the medical dots.
Yes,
Like we
yes.
understand what's happening and we understand the why behind medical advice. Because now, if you understand what the ibuprofen is doing to you, then you know why to take it. And I believe that should be a motivation for you to take it, to be compliant to the medication, right? Which helps you. So things like that. Yeah. Okay. Yeah. So Brie, just to summarize, with the pathophysiology of the disease or HS, really it's just cells, oil clog up or block the hair follicle. Then the bacteria there start dividing. And once they divide, the hair follicle bursts. And then the white blood cells come in and they start fighting this as a foreign object. It's like an antigen. And that is what leads to inflammation. And that inflammation is what leads to the symptoms of pain, tenderness, redness, swelling. And then when the white blood cells like die, they form the pus. So that alongside other fluids that get secreted during inflammation, they lead to the drainage. And so pretty much that's the drainage that sometimes, flows out of the abscess or nodules. And then inflammation, anytime it happens, when it resolves, it leads to scarring. Okay. And so that is what leads to the scarring in a chest, and to the appearance that we typically know to be like HS or hidradenitis suppurativa. And my viewers, don't worry, I'm going to include a picture here so you can see what I mean when I say scarring in a chest. And so when it progresses, the lesions go ahead and form some things called tracts or sinuses, so that connect different nodules together, and where the drainage, it's like they form like a pipe or a bridge or something to connect the nodules. Yeah. And so, yeah, so the anatomical or the physical appearance of the HS is what leads to like the different stages, or how doctors categorize HS into highly stage 1, stage 2, stage 3, right? And that's different from the severity, because you might have like just one nodule and it tremendously affects your life, right? So that's severe for you. So it's patient specific. But then for the stages, it's how it's behaving anatomically. So HS can for one person it can be one nodule that recurs frequently. For another person it can be two nodules. For another person it can be numerous nodules and scarring and tracts and sinuses and everything. And it's a devastating disease. And Brie, I'm curious to hear about how your experience has been socially when it comes to HS. So medically, you've shared how sometimes it's painful, you can't even walk, you get flare-ups, they're unpredictable, they just come and go. Sometimes you might be at work and you have a flare-up. So I'm just curious to hear about how HS has impacted your life outside of the physical symptoms that you have. How else has it impacted your life?
Um, that's a good question. I'll try not to get emotional about that question, but I think it's
Mhm,
helpful, if anyone watching is currently suffering with HS, I think
mhm,
for me,
mhm,
it's taken a hit to my confidence and my self-esteem for sure. Even though I know like because of where my flares happen, I can typically keep it up, or kind of smile through it or push through it, but I know everyone is not that fortunate. Uh,
mhm,
like I said, it has and it does weigh on my self-esteem. Um,
mhm,
if you have a flare up, you are really uncomfortable. When it finally does open up, you have a lot of, as you put it, the drainage, which
mhm,
sometimes have, and I'm being very open and honest, it can sometimes have an odor. So
mhm.
you can be typically very self-conscious about if anyone else is smelling it. Um,
Right.
if you have hidradenitis, you know what I mean. Um,
Mhm,
so that takes a toll. um, Sometimes it's difficult to plan or look forward to things because
mhm,
you do not know if you're going to have a flare at that
mhm,
time. You don't know if um, you're going to be mobile. You're going to be
mhm,
able to. It impacts the clothing that I wear.
mhm,
You know,
mhm,
summertime, you want to be, your arms out, you want to you want to swim, you want to do things like that.
mhm,
And the presence of HS makes that
mhm,
extremely difficult to plan for or be excited for. Um,
mhm,
I'm in a wedding in a month, and
mhm,
I am excited, but also nervous about having
mhm.
flare at that time, or
Right.
the healing of an existing one and its visibility in my attire, my bridesmaid's dress.
Mhm,
And then sometimes it's hard to get others around me to understand
mhm,
the amount of discomfort that I experience with it.
mhm,
Uh,
mhm,
and the fact that it can be here, not here today, not here yesterday, here today. Uh,
mhm,
it's unpredictable. I do know, like I mentioned earlier, I do know what my triggers are. Um,
mhm,
but even sometimes my triggers aren't my triggers, or even sometimes I don't even realize that I've eaten something or I've done something that is ultimately um,
mhm,
causing the flare. So
mhm.
um, it's it's tricky.
Yeah.
Yeah.
Yeah, it's very tricky. And again, thanks for being vulnerable and sharing that. And I think this is why this recording this video is important, to create awareness about HS. Because one of the myths that people have out there about hidradenitis suppurativa is some people, when they, let's say, unfortunately, they get to smell the odor, automatically someone will just assume you do not have proper hygiene practices.
Mhm.
But no, HS is not due to improper hygiene practices. In fact, it's kind of an autoimmune
Yes.
process. You
Yes.
know, your immune system just responds in a way that it shouldn't respond. It over responds to something that's not harmful to your body. And like I explained, the hair follicles. So, again, let me put it out there, HS is not due to poor hygiene.
Yeah.
So, yeah. So when you're out there and you smell something, please don't judge.
Mhm.
And if you're suffering from HS, I'm sorry for anything that you might have gone through that made you uncomfortable. And again, that's why I think this video is very important in creating awareness about this disease so that we can reduce the stigma that surrounds it. So, and it sounds like it has a lot, it impacts your life like significantly. It's not just a boil, the way people think.
Yeah.
Yeah. It affects the clothes you wear, you know, it affects which events you show up to, you know, and it's not like, and let me put in a shameless plug here about dermatology and why I find it interesting, right? So unlike, let's say, a disease like heart disease, for instance, yes, you might be suffering from it, or diabetes, for instance, you might be suffering from it, right? It's a terrible disease, but I say at least those kind of diseases, patients have the privilege of privacy, kind
Mhm.
of. But when it comes to dermatological diseases, especially something like hidradenitis suppurativa, it's very hard to like afford privacy, and I mean privacy even with your partner,
Mm.
because some, like, you want that privacy for yourself, like you're an individual before you're with somebody else.
Yep.
But with dermatological diseases, like, your partner is able to see. So, I'm just imagining, even let's say when women give birth, you're draining, you have milk, you're bleeding, like, it's uncomfortable, and it really needs an understanding partner.
Yeah.
So that's why, again, dermatology is important, so we can have experts who understand these diseases and help manage it, or even help and change the narrative about these diseases so that it's normalized and not stigmatized against. So it's not to minimize any disease or profession or anything, but it's just to bring a different perspective on a disease here. So with HS, again, significant impact on your life. And I was reading last week, as I prepare for this year-long research, like, a lot of, like, almost all patients with HS also suffer from some mental health, issues, because you're anxious. You don't know when you're going to have a flare up. And when you do, let's say you're hosting a meeting like this, and then poof, you have a flare up. So
Yeah.
it's like, yeah, it's terrible. So, and then, so the doctors who can take care of patients with HS, it's not just the dermatologist. It's like you need a group of people, right?
Yeah.
Yeah.
And that's one thing, that's why I'm super appreciative of the dermatologist that I have now,
Mm-hmm.
because he does have a small research team that he works with, and I've participated
Mm-hmm.
in a number of like tests or studies that he's done, wanting to try to, when I had my surgery, wanting to like take a sample of that to see, one, to make sure that it's truly HS, but
Mm-hmm.
to try to just further understand why this happens, and not really necessarily why anymore, but what
Mm-hmm.
can be done to really start to remedy this. So I
Mm-hmm.
participated in a number of different studies with him,
Mm-hmm.
as whether
Mm-hmm.
it benefits me, hopefully it'll benefit me, but
Mm-hmm.
I would love it if it could benefit, someone who comes after me and has this illness, this disease, however you want to say it. Um,
Mm-hmm.
but it is, and you hit on a lot of key points, it has nothing to do with hygiene. It has,
Mm-hmm.
let me tell you, I'm going to shower, I'm going to bathe. I am.
Mm-hmm.
And probably
Mm-hmm.
even more so and more frequently because of my hidradenitis, and because
Right.
of just
Mm-hmm.
consciousness around, if, I'm having some drainage, I'm having a flare,
Mm-hmm.
and if anything, you need to be more vigilant with your hygiene, because you need to
Yeah.
keep the area on or around that abscess as clean,
Mm-hmm.
as dry, and as free from bacteria as possible. um,
Mm-hmm.
it's quite the opposite, actually. um,
Mm-hmm.
and then, like,
Mm-hmm.
the
Good point.
yeah,
Yeah.
so
Mm-hmm.
have to be just a little bit more, serious about the way in which you are caring for yourself. And you hit on, you talked about like your mental health. Uh, that absolutely resonates with me. And I imagine those like myself who suffer from HS as I do, they probably really do struggle with their anxiety and their mental health and esteem. And
Self-esteem, yeah.
you have a flare, or you're coming off of a flare, or just the anticipation of a flare. You're depressed, you're down, you're stressed, and that takes its toll on your ability to show up in all the ways that you need to show up, whether it's as a partner, a friend, a daughter, a sister, an employee, a professional. It impacts so much, and you never, because it's chronic, because it sometimes it comes without warning. I will be honest, there are some times where I will have something and I know I'm about to have a flare. I know it. I know. But then there are times more often than that where I'm like, I don't even know where this came from. I don't. But what I will also say is it does, it is some, it takes its toll on your mental health because you will try to still appear to be okay. And you
Right.
try because it's so unpredictable. You may not want your employer to know because they'll think, oh, you're just coming up with stuff because you're just fine yesterday. Yeah, I know.
Yeah. But
Today,
I'm not fine today.
yeah, I feel it coming,
Yeah.
and it's here. Uh, and so it unfortunately causes you probably not to be as open and as honest. And then, not even to mention in a romantic relationship,
Yeah.
as a partner, you have to you don't want to be, but you have to be open and honest. I needed my partner to know what I was
Yeah.
experiencing, what the discomfort was. It
Mhm.
took me some time. It really
Yeah.
did. I would hide it for sure.
Mhm.
Um,
Mhm.
some time to feel comfortable.
Mhm.
Not because of I was ashamed of it necessarily, but just because I just wasn't sure. How do I even explain this? How do I explain what's happening? Like, how do I even tell, like, that type of thing?
Exactly. Yeah. Yeah. Because again, people don't know. And that's why the importance of this video. And that's why we're here connecting the medical adults. So
Exactly.
people can understand and partners can be more supportive, you know? Because I feel like if people don't understand, then it's so easy to like, just what is it? Like shut down someone and be like, yeah, things like that. So, but anyway, another thing I wanted to point out about HS, like we've said, and I'll repeat it again, it's not because of poor hygiene. In fact, people who have HS are more vigilant and practice are even more hygienic
Mhm.
than most of us. So it is not due to poor hygiene. The other thing I wanted to point out, and first of all, I'd like to hear your experience about it. It's like when you're first diagnosed, was there a conversation about like weight
Mhm.
and other lifestyle choices? Do you mind sharing that?
Yeah, absolutely. My doctor in Charlotte, he was the
Uh-huh.
one who first even got me to understand that there could be a correlation between
Uh-huh.
my weight,
Uh-huh.
stress, food,
Uh-huh.
all of those things triggering it. Uh,
Uh-huh.
and that's if you read about it, etc. Just like with I think many diseases, your weight, uh,
Uh-huh.
your overall physical health plays a
Uh-huh.
toll on, how severe it gets, how bad your symptoms are, etc. But
Uh-huh.
short answer to your question is yes. Yes.
Uh-huh. Okay. Yeah. So, and that's the other thing, like you mentioned, just like many diseases, like being overweight can is correlated to
Mhm.
certain diseases. But another myth I want to demystify today, it is not the cause of HS. At least we don't have any scientific studies that have proven that weight causes HS, right? The truth is, many people who have HS are overweight But also the truth is, it is not because of their weight that they have HS.
Mm.
That makes sense, right? And I'm saying this because a lot of patients reported that they felt dismissed because it's like you get diagnosed with HS and the first thing you're told, go lose weight. I mean, I'm sure like someone who is overweight and they know, like even them themselves, they're uncomfortable and like, okay, I need to lose weight.
Mhm.
So yeah, so again, to destigmatize that again. It's not because someone is lazy, they don't want to work. And even being overweight, sometimes it's not like someone is lazy. It's just, we all know losing weight is not easy. Even if you want to lose like 10 pounds and you're not overweight, you just want to be in shape, it's not easy. So, anyway, I wanted to put that out there. The other thing is smoking as well.
Mm.
So in fact, yeah, in the previous weeks, again, I'm getting ready to embark in this research on HS. And one of the things the dermatologist taught us is in the future, when we diagnose someone with HS, for instance, our first discussion should not be around weight and smoking and all the lifestyle diseases. It should first to make sure the patient understands the diagnosis and then show support to them, and make them feel comfortable first. And then after that, now you can have discussions about weight loss and smoking cessation and all that, because anyway, they are good lifestyle diseases, any lifestyle choices
Yes.
anyway. And yes, they might help reduce the flare ups and stuff. But I wanted to put it out there so that someone with the chest does not feel guilty. It is not like your fault. You know what I mean? Because I know some people feel like, oh, maybe I've not been eating right and now I'm overweight and now I have a chest and it's affecting me. No, it is
Mhm.
not your fault. So
Yeah.
anyway, I just wanted to put that out there.
That's a really
Uh,
good call out. It is
mhm,
because sometimes it can like diminish the experience that you're having or make it seem like it's something that you've done
mhm,
cause the diagnosis of hidradenitis, and it's not. That's not true.
mhm,
I mean, there's all
mhm.
this research about trying to figure out why this happens, and why
Exactly.
is one person more susceptible. I'm the only one that has it in my family. Like, why does like no one else has it? Um,
Mhm,
of course, my family has been so super supportive, and as soon as I
mhm,
y'all, I got it.
mhm.
They're like, "Oh my gosh, what do you need? What do you need?"
Yeah.
But
Mhm,
that point from, if I could give any advice to a doctor,
mhm. Yes, please.
um,
Yes. Mhm,
leading with really wanting to understand the patient. And I
mhm,
hate to say this at the beginning, but my experience with HS is going to be
mhm.
different than maybe others that will watch this video. Um,
Yeah.
I, from what I understand, people have different triggers. Some people
Mhm,
are worse at certain times of the year. Some people,
mhm,
you know, will have a flare and then not have a flare again for a long time. Everyone is different. And so
mhm,
it would be really helpful and encouraging for, you know, a, a doctor, a dermatologist to kind of really tailor their care, their engagement with the patient,
mhm,
with that patient. Um,
mhm.
and when you get sick or you don't feel well, the last thing you need is for someone to say, "Well, it's because you did this or because
Right.
you're doing that." Is in the back of our mind.
Mhm.
9 times out of 10, we know what we should.
Yeah.
This is not one of those things where there's one in particular thing that you can point to say,
Mhm.
it's because you did this or you are this or
Mhm.
so.
Right.
That's a really
Okay, that's Thank you. And I hope my fellow medical students, healthcare professional students, and healthcare professionals themselves, including doctors and dermatologists, I hope you've heard that from a patient, right? You want us to treat each patient differently because each patient has a different experience,
yep.
right? Very, very different. And that's an important point, really. Thanks for bringing it up. And also, thanks for saying that you're the only one in your family who has this, because I was going to ask you, is it familial? Because it's very interesting sometimes, like in the past couple of weeks that I've talked to patients with HS, interestingly, some of them report, oh yeah, this runs in our family. We get boils all the time. So while it can be like a random occurrence, like for you, Bree, for some people also it runs in it can run in the family. And
Yeah.
again, still studies are going out there all over the world trying to better understand and characterize
Yeah.
this disease. So I'm just curious for you, Bree. I might have an answer, I might not. But as someone who has suffered and is suffering from HS, like what kind of questions do you have for doctors? I know you have a great dermatology, sound like it,
Yeah.
but do you have anything in your mind, like burning questions? I don't know,
Yeah.
curiosity.
No, this is great. I'm gonna
Mm.
take you up on that. Um,
Okay.
I think one of the questions that I would obviously we talked about triggers. Like I know
Mhm.
for me the things that will trigger, which any type of food or anything that causes inflammation is
Right.
you know going has the potential to cause a HS flare for me.
Mm-hmm.
When you think about if there's a place that we get to where there's an idea of like things you can do from a preventative standpoint, what
Mm-hmm.
ideas would you have about that? Or what some of your learnings kind of, leaned you, what have you been able to glean from those learnings?
Mm-hmm. Mm-hmm.
Like something that someone can do at any stage of HS,
Uh-huh.
um,
Uh-huh.
potentially maybe prevent,
Uh-huh.
repeated or frequent flares, or to maybe ultimately get into a point where they are, you know, in remission, if you will.
Yeah. Yeah, no, that's a good point. I know, and like, yeah, because for me, I'm big on preventive medicine, right? And that's why the medical dots again, I'm gonna plug in the purpose of this channel is to educate people about their body and simple things that they can do to either one, prevent themselves from suffering from chronic diseases, or if you've already been diagnosed, to help you learn how to manage it, to better understand it, so that when you work with your doctors, your nurses, you're able to be an active member of your healthcare team. And really, that's the purpose of this channel. So, Brie, I'm really happy you brought up that point, like about what can we do to prevent, like, first of all, HS from developing HS, and then if you have HS, what can you do to prevent the flare ups and stuff? And honestly, I don't have the answer to that. But one thing I can say, I know you talked about the de-roofing procedure that
Mhm.
was also done to you. I've read also in scientific papers that when they do that, at least it minimizes the frequency
Yeah.
and the intensity or severity of the flare ups. I also like different, and of course, I have to be careful what I talk about here because with the research that's ongoing. But I do know they're studying different things. That's why they're studying to better understand the disease first, and then once they understand it, it's like, okay, so we can do this to prevent flare ups. We can do this to prevent occurrence, and in
Mhm.
the future, if we have a better understanding about the genetic basis of HS, then you'll be able to know. Let's say, like, how with breast cancer, they can know, oh, if you have the BRCA1 or 2 genes, you're at a higher chance of developing breast cancer. So then they can do the genetic testing. You can get prophylactic mastectomy, things like that. So that's what's ongoing right now. People are studying HS to better understand it, and hopefully in the future we'll have more information on how we can better prevent this disease. But in the meantime, like you said, I know doctors encourage patients. And again, I have to put it out there. I am not a doctor. I'm not certified to give medical advice, but this is my understanding of how currently HS is being managed. I know doctors encourage patients to use like antibacterial cleansers, like you say, like benzoyl peroxide. Like CeraVe has a nice one, and different brands have the benzoyl peroxide, and that helps to keep bacteria away, which, like we discussed, it's part of the pathogenesis of HS. And sometimes dermatologists will prescribe like the clindamycin 1% topical cream to help with that, and then the over-the-counter pain meds. But sometimes some patients experience terrible pain that they even have to go to anesthesiologists to get pain management with narcotics and all that. So, like you said, everyone's experience is different, and it's really a disease that everyone should take seriously and not just dismiss it or take it lightly.
Yeah.
So,
I
yeah.
will say probably the best thing that has come out as a result of me having hydradenitis, my pain tolerance is high.
Yeah. Oh
So,
man, it's
um,
like a good thing and not a bad, and not a good thing at the same time.
a
Uh-huh.
good thing, but my pain tolerance, like when you're talking about people having to manage that pain, it is really debilitating and
Mm,
excruciating pain
mhm,
that has left me in tears, and it's bad. It's bad, bad.
mhm,
yeah, all of everything that you're saying really does resonate.
Mm-hmm.
And it's you can't always have this type of conversation. Um,
Mm-hmm.
where someone wants to know, well, tell me about it. Let me and it sometimes you maybe take for granted the journey too. Like
Mm-hmm.
I think I've like even answering your question, I'm like, wow, okay, this has been there's so many things that has
Mm-hmm.
happened and impacted by me having hidradenitis, and so much of my self-esteem has been
Mm-hmm.
impacted by it. It is something
Mm-hmm.
that I manage daily.
Mm-hmm.
Some
Daily.
there
Yeah.
is some portion of my day where I am
Mm-hmm.
attending to something
Mm-hmm.
related to my
Mm-hmm.
hidradenitis. It
Yeah.
is. Um,
Yeah.
and it's funny because I feel like if I was kind of just beginning my journey, maybe I'd be more like emotional about it. But
Mm-hmm.
honestly, it's just been a part of my life for
Mm-hmm.
so many years and so long
Mm-hmm.
now, uh,
Mm-hmm.
that I've just been managing it. Um,
Yeah.
I don't know how that sounds, but I've just been trying to manage it the best way I can. Uh,
Mm-hmm.
but there are instances like kind of how I explained before with my, self-esteem or like me looking forward to things, etc., and
Mm-hmm.
how
Mm-hmm.
chess is going to impact that where it does get to me.
Mm-hmm.
Yeah, yeah.
Yeah, I hear you, and I'm hoping this conversation will not like take you back to the dark days, but
This
I'm
was
hoping that okay, it will serve like who I've gone through all that and I'm good. I hope it will
yeah.
serve as a source of encouragement for you. And you asked how does it sound? To me, it sounds great and it sounds wonderful because again, and I'm just gonna say it again and again. The reason why I think it's important for people to understand their body and to understand the diseases they're suffering from. It's because I strongly believe that once you understand what's going on in your body, then you take charge of your health. And it sounds like that's exactly what you're doing, Brie. So clearly, when you've taught me a lot about HS, and when you speak, it's like you know this, you understand it, even if you don't know a lot. I mean, you know a lot, right? You know this, you understand it, and that's why you're able to take charge of this disease, and you don't feel like, oh, you're not victimizing yourself. And I'm hoping that that is what like this video and many other that we've recorded in the past and going to record in the future can
Yeah,
enlighten people and empower them to take charge of
yeah.
their health, you know.
I hope so. I hope you don't walk away from this feeling like it has to be like the thing that defines you. I
Yeah.
People who I don't share that I have hydradenitis with don't know that
Mhm.
I have it. They don't. I'm
Exactly.
sitting here just like this, and I realize that's a privilege because everyone that suffers from this doesn't have that opportunity. Um,
Mm-hmm.
doesn't can't just cover it up and move on. Um, so at least I have that, and so one of the things that I just try to focus on is just the positive things. Like every situation is different, but at least when I have a flare,
Mm-hmm.
know what to do. Yes, it's painful. Yes, it's annoying. Yes, it's emotional. Yes, all those things, but I try not to like make it the sole part of who Brianna is,
Mm-hmm.
and such a factor to consider in
Mm-hmm.
life, if you will.
Mm-hmm.
Easier said than done. Like I said, it's something that I have to it impacts my diet, it impacts
Mm-hmm.
my level of activity, my ability to exercise is something
Mm-hmm.
that
Yeah.
impacted by the presence of or the potential for a flare.
Mm-hmm.
Um,
Mm-hmm.
but I really try to press through it and just like it's like routine now.
Yeah.
Happens.
Yeah.
I try to press through it. But it's interesting because like this conversation has been really good because like I've gone back and just thought about because you're managing it every day, sometimes you don't stop and think like, whoa, like I've come a long way.
Mm-hmm.
Now it has a name. I can talk about it.
Mm-hmm.
While there's not a cure, there's research. Obviously, someone somewhere is hearing about it, and people
Mm-hmm.
talking about the impacts of it and the why behind it and how we fix it or how we minimize it.
Mhm.
Because I see a lot of people like me on, social media who are dealing with it way, way worse than me. And so
Mhm.
I hope that if anyone who watches this is struggling with HS and they, feel depressed, they feel down, say
Mhm. Mhm.
yeah, it sucks. It really, really does.
It's
Um,
yeah.
but you have HS. HS doesn't have you. So
Ah, I love that. Can I
yeah,
use it? Can I use it on this channel?
yeah,
Yeah, I
absolutely can.
like it. You have a chest. A chest does not have
That's
you.
exactly.
Mm.
Yeah.
I like that. And I think that's a good way to end this video. You
Good.
have HS, but HS does not have you. I hope you feel empowered. I hope you've been able to connect those medical dots. And let me just summarize the dots so that you can connect them. Again, HS is the short form for hidradenitis suppurativa. Medically, we define it as a chronic inflammatory disease due to a dysfunctional hair follicle. Now, in layman's term, it's a disease that affects the hair follicles, and you know what happens? Different things happens at the biological level, and you end up getting a flare up where your white blood cells come in and start fighting your own natural cells. So it's technically an autoimmune disease. So it is not due to improper hygiene. It is not due to being overweight. At least we do not have studies that have proven that. It is not due to smoking. All this I'm saying, it is not your fault that you have HS. It just happens. And I hope you can get encouraged by me telling you that a lot of people out there, a lot of experts in skin diseases, are dedicating a lot of time and energy into getting to better understand this disease, to characterize it, and hopefully come up with better ways of preventing it in the first place, managing it when it happens, and hopefully even a cure if possible. So I hope those dots are connecting. Let us know down below what you think about this video, what you've learned from this video. If you're suffering from a chest, feel free to comment down below if you're comfortable. If not, message me on Instagram. I'd be happy to hear about your experience. And if you have any questions, please bring them up. Again, I am not a doctor. I'm not licensed to give medical advice, but I'm a student, a medical student who is learning. And I think the people I like to learn most are the patients. So feel free to reach out. Brianna, my sister, thank you so much. I always enjoy recording the Medical Dots videos with you. Thank you for your time. Thank you for your input. And most importantly, thank you for sharing your journey with HS and being so vulnerable. I hope that this video and you sharing your story will not just be taken for granted. And I hope some people will feel encouraged and motivated, and even doctors will feel more inspired and informed with the good advices you've shared to us. So thank you so much.
Thank you for having me.
Yeah. Okay. Bye.